So greetings, everybody. In this webinar, we're going to be talking about an important addition to our tool chest of wellness devices, and specifically light therapy or photobiomodulation, as the industry calls it. The MyElle wand is a light therapy device. Most of you know this, but it's designed specifically for vaginal health. Although we have heard of other people using it for other issues, since it is emitting light and therefore providing many benefits to cells, all of which need light to function. My name is Dr. Ginger Bowler, and it is my company, Energy Events and Products, hosting this MyElle webinar, along with many of our colleagues, friends, and business associates. This is a discussion on the most private area of our bodies and our lives, and therefore often the most private part of our lives, our sexual health, happiness, and well-being, our sexual expression, and our reproductive and intimate life. I, for one, rarely talked about this part of my body or this part of my life or issues associated with it before MyElle. And once I did start talking about it with my friends, and I noticed that I started to stumble and stammer verbally. And it was curious to me, like, why? Why was this so uncomfortable to talk about? Because many of us, we just don't do it. But you know what? Now we can, and we will, and we need to. It is important. Many of us have found out that there are secrets and sometimes traumas beyond the physical condition that are buried in our tissues and in our cells and in our memories and in our cellular memories that are somehow released when we shine light on this very specific light in this very specific place. For women, our uterus is our power center. Actually, for both men and women, our reproductive organs are our power centers. They are important. And no matter our age, we want them to be healthy. Interestingly, this technology, light therapy in a wand, is a device that most of us already understand. Because of the many years we have been using light therapy externally on the body. But now we have a device in the MyElle Vaginal Rejuvenation wand that we can use internally. Many of us have studied the effects of light on the body, the difference that the different colors or wavelengths of light have upon the tissues, and what was happening to our physiology when we shine high quality light at certain wavelengths on the body. The science of light and the understanding of how important light is to every living organism is not new. It goes back to the beginning of time, when God said, "Let there be light," and there was light. Light has been used to support health and healing for centuries. And now there are thousands of published studies on the benefit of light therapy. I have been teaching in the natural healing arts in the energy medicine field, where I have my doctorate, for over 34 years. 12 years ago, I was introduced to light therapy and found it to be the easiest modality I had ever used or taught. This year, I was introduced to the MyElle wand and found it to be so, and also the most fun and enlightening. And although we have much to share on the science of light, for me, I'm always fascinated on what is happening on the different levels energetically to all of the levels of our health and well-being, since they're all so interconnected, that the physical, emotional, mental, spiritual bodies, social bodies are all so interconnected. And when we help one body, we're helping the other body. I'm fascinated watching and listening to the stories of transformation. Each time we confront, let go, or heal a part of our history that needs a little light to shine upon it so that we can reclaim our own perfection and vitality. We're very fortunate to be surrounded by so many gifted practitioners of light therapy, many of who are on this presentation or who will be watching it later. But I'm especially personally grateful to my two co-founders of our light therapy certification curriculum, the Let's curriculum, and that's Marcy Denton and Isabel Martinez, both of whom just so happen to be on this webinar today. And I want to thank you. I want to take this time in front of our whole industry to thank both of you all for the difference that you have made. And then I also want to extend the thank to PTI, the Photonic Therapy Institute, who works very closely with us. I want to thank them for their part in supporting and expanding these educational opportunities in light therapy or photobiomodulation. We're finally seeing our grunt work for decades now, leading us to other important devices in this field of photobiomodulation. And it's because of our Let's program that Brie Abawi, the CEO and founder of MyElle, connected with us. And this led us all to this wonderful product, the MyElle wand, and to being here today. But before I introduce Brie and others, I want to give a quick overview of some of the issues that we're going to be talking about today. And I'll be projecting on the screen, the PowerPoint. So, vaginal health facts. About 17% of women ages 18 to 50 experience vaginal dryness during sex, even before menopause. That was really surprising to me. 3 out of 4 women have pain during intercourse at some time during their lives. Then we have the issue of incontinence. Involuntary leakage of urine is a symptom that affects 1 in 4 people. And this problem seems to increase with age. Up to 75% of women age 60 above the age of 65 report this as an issue. The thing we love about MyElle is that it's 100% natural. There's no side effects. It's drug-free and private in-home use. So one of the things that, and we're going to talk more about light therapy, and because the wand is using light therapy, as we said, is that we know that with photobiomodulation, there is an increase in the nitric oxide released inside of our body when we shine offer the body this high quality light. And with the release of nitric oxide, there is a decrease in inflammation and an increase in circulation, and many other physiological things are happening. But also we know things about the different wavelengths, or what we would call colors. And one of them is that blue light sterilizes or helps with the bacterial issue. And in this case, we're specifically talking about vaginal bacteria. And therefore, there is not only the detox, but the elimination of the odor, which can be very embarrassing on many levels. We have, some nice, some wonderful, as a matter of fact, testimonials that we have heard. And one of them had to do with the 10-year issue of odor, with just a couple uses of the MyElle where it was completely gone. So there is a lot of times not just embarrassment, but actually, well, that would be an embarrassing situation, even with your partner. But incontinence, I mean, this is a big issue in our world right now, is incontinence. So we talked about it already, the improving of vaginal dryness, relieving menopausal symptoms, and all of that. On this particular screen that you're looking at, it says vaginal tightening. For a lot of women, this is an issue. Reducing scar tissue. Why does scar tissue form to start with? Well, one of the big reasons is, after some kind of a break or trauma or cut or whatever that can happen in childbirth, scar tissue forms in the body because of a lack of circulation. So anything that's going to help improve the circulation can help with that. Plus there's other effects. And then they aid in the birth canal rehabilitation. So before I introduce Bree, I wanted to take a moment to acknowledge all our light therapists who are helping to get the word out about this great modality. It makes a difference. Our world needs to lighten up in many ways, and certainly this is one of those ways. Okay, so now I have a picture of Bree on the screen, but we actually have the real Bree. So Bree, if you'll go ahead, she's the CEO and founder of MyElle. If you'll just talk to us, Bree.
Yes. Hi, Ginger. Thank you so much for having us. And I really, really appreciate you taking the time to educate people on the MyElle. It's one of the most difficult things we've found that we've had trouble doing, just because there's so many questions to answer and it's just hard to get to everybody. So thank you for that. And very well put, everything you said, I agree with. And everything that you've introduced about MyElle, these are all the things that women are talking about and that are having issues with. And we've had so much good feedback on, as far as, atrophy, laxity, bacteria, UTIs, trouble with hysterectomy. After having childbirth, there's so much trauma in the vaginal wall and the vaginal canal. So this very much helps with all of that. One of the biggest questions I get is, how did I get into this? How did I end up with this MyElle wand and selling it and making it and all of that? Well, basically, I started about 17 years ago, actually now, in infrared saunas. So I was the second largest infrared sauna manufacturer in the nation, and for about 12 years. And so my background really lies in manufacturing. I have a passion for wellness and health and a huge passion for women. Very young age, I represented Canada at the first ever International Leadership Conference in Sydney, Australia. And I did that by writing an essay on women in leadership. So I think for me, it goes very deep and it goes really far back. As far as the infrared saunas, I got introduced to so many different avenues of health and wellness that weren't just, medicine or drugs, which, yes, there's a place for that in this world, but I like to be preventative. And so in preventative health with the sauna, I saw so much success, and that's wavelengths. So I wanted to go a little deeper and I wanted to get a little more one-on-one with my customers. So I developed a 3-step program called InfraSculpt, and I used red light, near infrared, and diode bars, which I'm sure you're familiar with, or some of your customers are. And then I would put it on the body for detoxing the body, emptying fat cells, so they could be a little more lean, but also a lot healthier. Then I put them on whole body vibration, which helps with draining the lymphatic system, and then into the infrared sauna for raising the body's core temperature and detoxing the body. So, but when I started using the lights, I started getting so much feedback from all these clients of mine that they were having less pain, people getting off chronic pain meds. And I thought, wow, this is amazing. I was also dealing with 93% of my clients being female. Because they were taking their clothes off to get their treatments with me, they became extremely vulnerable, and they would start sharing things with me that they would never share with their doctor. And a lot of it was vaginal health issues affecting their sex life, their life in general, and just their overall well-being. That's when I thought, you know what, there's a huge, huge place for this for women, not only to cure them or help them with their vaginal issues, but also to open the platform, which is exactly what we're doing today, to try and reframe this narrative from embarrassment and shame around intimate health and wellness, to open it up to being and discussing it in an educated and impactful way, just like we're doing today. So again, I'm super grateful that you are able to do this and provide all this light knowledge and energy knowledge around our product, because it's going to help so many women. And I'm really, really grateful for that.
Excellent. Okay. Thank you so much, Bree. So again, just to recap, we want to invigorate our lives. We want our vitality, and we can't help one part of the body or one part of our life without helping the others. So this is bringing light to our life in so many ways. Again, to boost our sexual life, to reduce sexual apathy and enhanced vaginal sensitivity, just a couple more issues that it can support. On the screen, you will see the wand with a cover on it. And I'm saying that specifically because we make some assumptions that our customers know certain things. And we had some reports with people not realizing that you have to take that cover off. So I'm going to show you a picture in just a few slides that will actually show you with the cover off. But here's the MyElle wand. Again, we talk about photobiomodulation is what light therapy is called now in the industry. And it even encourages, muscle cells, nerves, connective tissues, and so many wonderful things in the body, in the health of those tissues. So how does your MyElle wand work? Well, it's non-invasive. It's handheld vaginal wand, and it uses a vibration also to promote vaginal health. Again, light is every living thing needs light. So our cells benefit significantly from light by, releasing the nitric oxide, but also the specific colors or wavelengths of light. When you use beneficial light, you increase the health of your cells, and this means faster cellular repair and healing. MyElle's design helps you achieve optimal vaginal health with the benefit of red light and blue light. On the screen right now, we have the specific nanometers of light that MyElle uses. So it uses blue light at 477 nanometers, and research has pointed to the fact that this, bacteria is killed with blue light. Now, before the pandemic, I traveled a whole lot and was in airplanes a lot. And I started to notice that the newer airplanes often had a blue light in the bathroom. And that made sense to me, kill the bacteria and therefore the odor. I've also, I bought a new house 2 years ago, and I noticed when we were shopping for refrigerators, how many of the higher end actually refrigerators, you'd open the door and there was blue light. Why? Because blue light kills bacteria. And that's why blue light, for those of us that use light therapy externally, we'll often use blue light for skin issues and bacterial issues for that reason. Red light at the 650 nanometers is what MyElle uses, stimulates blood flow and increases oxygen. So it's red light that can help to fight the dryness and repair damaged cells and increase the vaginal elasticity and help to release the nitric oxide, etc., etc. The vibration function is there for a specific reason besides just making it easier to use, okay? And that is because it improves the muscle strength of the pelvic floor and increases blood flow. So this leads to increased and enhanced vaginal sensitivity and improved sexual function and satisfaction. So here is the picture of the MyElle wand with the cover off and it turned on, and you can see the red and blue light. On the screen right now, and this might be a little bit more than you want to know, or you may have already mastered this about the effects of photobiomodulation, but basically you can see that the wand is at the top of this graphic file, and this is a graphic of tissue and the light shining on the tissue. And if we look at the top right part of this graphic, this picture, we see that the arrows pointing down, indicating that photobiomodulation helps to decrease inflammation and edema. Okay, so but it helps to it helps to support nerve regeneration and cartilage production and bone formation. So with again, just to remind you, photobiomodulation helps to release our body to release what's considered the miracle molecule of the body, which is nitric oxide. And in the presence of nitric oxide, not nitrous, that's laughing gas, but nitric oxide, there are many, many, many physiological processes that are supported in the presence of nitric oxide. And one of them is the release of osteoblasts. So that would mean that it would help in the strengthening or the repair of bones. Okay. Another thing that nitric oxide or photobiomodulation supports is muscle regeneration goes up, and muscle atrophy, which means the wasting away of the muscle, goes down. So we want that. Most of us are really interested in the collagen production benefit of using light therapy. And then at the top left of the screen, the picture is angiogenesis. What this means is the regrowth of tissue. And so many years ago, my teacher, Hannah Kroger, and many of you all have heard me talk about her in the past, had told us in the future, and she was so incredible for what she told us that's come true. But she said, in the future, you'll go to the hospital to regrow your organs instead of having them taken out. Well, now we see that with light therapy and, and other wonderful things that are happening right now in our world, that we actually are able to regenerate the body. Okay, so it says, after having children, can MyElle help me? Well, we know that there is often a lot of trauma in childbirth, and childbirth can stretch and cause damage to the surrounding tissue and the vaginal walls. So by improving collagen formation, the wand can assist with the vaginal elasticity and tightness. So great choice for us mothers. Okay. The next screen says, I am perimenopausal. Can MyElle help me? Well, decreased estrogen can lead to the thinning and drying of the vaginal tissue, as well as an increase in inflammation. So MyElle can encourage tissue repair, promote tightening, and increase lubrication, which seems to be a really big issue for a lot of women. Photobiomodulation has been shown to increase fibroblast production, which can, as we said already, protect and produce collagen and assist with the skin and the elasticity. So yes, it's an excellent choice for women of any age who are beginning or experiencing the effects of menopause or well past menopause. Okay, so getting started with your MyElle, you're going to charge it for 12 hours. You're going to clean it after every use. You might need to use a little bit of lubricant, and you're going to avoid, remember, it's an electrical device, so you're going to avoid splashing water on it, when it's plugged in, and you're not going to use it when it's plugged in. You're going to unplug it. So again, why do I need to strengthen my pelvic floor? Okay, maintaining a healthy pelvic floor supports other essential body processes, such as holding up, we get prolapsed or dropped organs, and they cause all kinds of issue. When the bladder, prolapses or drops and rubs against the pubic bone, is what happens to create a lot of, to create the feeling of having to go to the bathroom all the time or incontinence. So we don't want those organs to be prolapsed. We want support in holding up the bladder, the uterus, the rectum, and maintaining control of the bowel and the bladder and the continence. So also working with the abdominals stabilizes the core, provides, lower back support. And the enhancing and maintaining sexual function and pleasure. It's supposed to be pleasurable. So how can this happen? It's through the process of photobiomodulation. The lights, along with the sonic vibration, work together to strengthen, tone, and tighten the pelvic floor muscles. As we said earlier, it does help with bacterial infections because of the inflammation. So the MyElle wand is excellent for someone who struggles with gynecological inflammation, and specific research has shown that blue light helps fight vaginal bacteria and the odors associated with it. On the screen here is a quick little rejuvenation guide. If you look on the top line, it's MyElle wand is being at $395, is being compared to other things that women can choose from to get help. And across the board, MyElle wins. Okay, it's home use, it fights dryness, it helps tighten, it increases sensitivity, decreases odor, helps with incontinence, and it's not invasive. You can see some of these other therapies are in the thousands of dollars. So again, we're all about self-care at home, especially in the time we're living in. We've heard many testimonials, but we have someone on the line today, Marilyn, that's going to share her story. And if any of the others of you would like to share us a benefit that you've had, then please put in the chat box so Luke can unmute you. But also remember, if you're going to share a testimonial, this is being recorded. And in case, you just want to not say your whole name or whatever, we are recording and we are sharing the link with people. Okay. And your name will pop up, when you talk. So, if you don't want that to happen, then just type it in the chat box and we'll read it without your name. So
the chat box will show to everybody.
Oh, the chat box will show to everybody. No, don't do that. Okay. Don't be shy. Okay, Marilyn, do you want to go? Marilyn, you have to unmute yourself. Oh,
mute.
There you are.
Okay. So, can you hear me?
Yes.
Okay. My story goes back with 2 episodes of breast cancer and many surgeries and many years of treatments, chemos, radiations, medications. And of course, through all that, that was probably with the 2 cancers that took me through 10 years of treatments. Consequently, well, the first cancer was an estrogen-related cancer. Of course, they depleted me of all estrogen for years. And of course, ending up with atrophy and no desire for intercourse. So I've tried several different treatments. One was the laser treatment, which cost $2,000 for the first treatment, which caused a lot of pain, like being tortured with a knife. I wouldn't recommend that to anybody. And I was supposed to go back for more treatments, which would have cost me anywhere probably $10,000 in the end result. And then I had to go through the part of healing from all the scars that caused. And so then I tried the MyElle, which is another product that you can buy. And of course, that would have been like $60 a month. So you're talking about cost. And then it wasn't helping with the treatment for me. And then my doctor recommended Intrarosa, which is another prescription drug. So that would have been $250 a month. And that wasn't helping me. So I was ending up with all these different irritations from everything, and then having to heal 2 weeks, having a healing process of 2 weeks at a time, and then trying to have intercourse again and then not being able to. And of course, then I just was at my wit's end, and I called Ginger and I said, can you help me with our light system to see if that would help? And she suggested different ways to use our pads. And then it wasn't just a few weeks later, she gives me a call and tells me that we have a great product that will probably help you. And so anyway, I said, well, I want it immediately. So I was able to get one. And I started using it like 3 times a week for about 5 minutes each time. And then I'd use it, then I'd remember to use it like once a week. And then I'd just maintain the once a week for me, and it's working. And my husband wanted to be here with me talking because we've had all kinds of issues, of course, trying to make all this work. And he is so excited about the MyElle. He will he will tell you, he's even used it. So anyway, we're just really happy that this product is here for us to use, and the price is well worth it.
That's great. And Marilyn is the one that brought my awareness of, a device that we needed for, this issue. She brought it to my attention by calling me, as she said, and we've been using just pad-based system, which most of us listening to this call use all the time. And so I told her, well, I don't know, we didn't have MyElle yet. Just use a long skinny pad like a Gotex between your legs, I guess. Let's just see, and put a bigger pad over your womb area. And but now my awareness was that there must be a device out there in the market. And then just, like energy attracts like energy. So you start thinking about something, and all of a sudden the universe is gonna, provide you the opportunity to run across it again. And that's when Bree called us. So anybody else want to share an experience that they've had? We will get to questions a little bit late, in a few more minutes, but right now, any success stories? I know there were some people that had some but couldn't be on this, so I'll share a few of them. And if they're raising their hand, so nobody's raising their hand. So I already said the thing about the one woman who said for 10 years she had an odor issue. I would say across the board that what I've heard is women having success with the vaginal dryness issue, like a lot of success with that, and a decrease in the pain in intercourse. For myself personally, again, because I pay attention energetically, I was actually shocked at some of my results, in that I just started having memories of things, not so much trauma, but self-judgment that I had over my own sexual nature. And I loved my Catholic upbringing, but my legal name is Virginia, like virgin, and I just, added on a lot of judgment to myself about anything sexual over the years that I had no awareness was still a part of my very adult self, mature self. There's been other things that I would say I only use one about once a week. And each time I use it, I have flashbacks, connections to certain periods of my life and what was going on. So for me, it's not been a physical trauma thing, but a lot of, I would say aha moments. One of the things that I realized recently was that I have 3 children, but they're not biological children. So I never carried them. So my hips never spread out like a lot of you all. And so, I was just thinking that how comfortable I am in certain types of pants rather than other pants because of that. Now that's maybe silly, but it's enlightening to know how come you get stuck in a place in your life sometimes. So any questions? Bree. Okay, Bree, you got some shares.
Yes, I'm the founder of MyElle, but the reason I am the founder of MyElle is because when I first started to use this wand, I have pelvic floor issues. I have diastasis from having a C-section and a lot of abdominal trauma from that. And I have polycystic ovarian syndrome, which causes me to have irregular periods my entire life. So when I started using the MyElle, very quickly, within a couple of months, my period was regular again, which nobody could figure out how that happened because I was sometimes 46 days, 50 days, 20 days, like it was all over the place. I did not have any pelvic floor issues anymore. So no peeing when I jump, that kind of thing. My vaginal dryness had gotten improved significantly. And especially when I was in my early 30s, I mean, that was a big deal in my life. And then I have friends with the same kind of issues, especially after childbirth. So it was just helping me and so many women so much. And that was the reason I jumped to improve it and make it better and bring it to the market.
Excellent. One of the things, testimonials that I've recently heard was from one of my friends and colleagues that after many years of painful sex, that she finally had not painful sex and was so thrilled about that, is so thrilled about that, but then has had some cases of it's painful again. And I just reminded her, this is the way our bodies heal. It's very often that sometimes we reach a plateau effect. So don't spaz if you've had some results and then you feel like you've backslid some. Now the body needs some time to retrain. Okay, we are retraining the body with light therapy. Okay, so moving along. How do you use your device? Well, you know, a lot of people, the first time I saw it, it looked like a sex toy, you know, and so I don't have to explain how to use that, but you hold, you know, you press and hold the button to activate the lights, and then you don't hold the vibration button. You just have to hit it quickly. Some people are are holding it down too long. So, you know, play with your wand just to see, you know, what it takes to make sure the lights are on and that the vibrator's on. If you want that part, you're going to lay on your back and you're going to insert it to your comfort level. I had, another woman who has had so much trauma in that area and hysterectomy and all kind of things that she was very stressed out about not being able to, you know, insert it all the way. You don't even have to get it inserted. Okay. I mean, you can just hold it at the opening there and, you know, get it 1/8 of an inch. That light is going to get in and penetrate the tissue. And as you can, little by little, you know, you'll see if you can get it further in and maybe use some lubricant and all that. Okay, a minimum of suggested use 10 minutes, 3 times a week. But like I said, mostly I would just use it about once a week. And each time I have a whole week of, you know, being fascinated at the movie that's playing because of a memory or thought that I had, you know, a memory that comes up. And again, like I said, a lot of times it's a self-judgment or it's a somebody else kind of a judgment. Okay, that I have to, you know, let go. The power of transformation is that it reaches back into our history, into our past, and transforms our experience of what actually happened. And that is definitely truly what's happening with me. And then, of course, we want to, you know, wash the wand. I do think we got, let's see, a question that came in. If you are 71, have vaginal dryness and thin vaginal skin, but are also too tight for intercourse where you need stretching, will the wand make you even tighter? Okay, well, Bree, you want to take that one? And I'm going to say no because of the lubrication effect and all of that. But, you know, light goes where the photons of light go where they're needed. And if it doesn't need to tighten something, it's not going to tighten it some more. It's going to increase the circulation. This is my answer. We can defer to Bree, but also Marcy Denton's on the line. So Marcy, Bree, do you want to take this question? Or add to what I've said?
Marcy can take it, but my main thing is that, you know, like you said too, you can insert it slowly as you go. My mom had the same issue because she has atrophy, almost 70 years old, and just hasn't had intercourse for years. So she was very apprehensive. I'm not putting that thing in there. And that was kind of her reaction. But slowly but surely, it actually helped do the opposite. It helped loosen everything up and all of that. But Marcy can probably speak more to the science behind that.
Hi there, I'm unmuted. Well, I'm 73 and I relate to that question. The truth is that time allows the light to help cells return to normal function. And the flexibility of the vaginal wall is natural and normal. It's not normal to be atrophied. It's not normal to be irritable. It's not normal to have inflammation. What the wand does is it gives the cells time to make those changes and the information to do it. So slow is the way to go. And I can say from my experience that lubrication is critical for those of us who have had years of no intercourse, and this is, our vaginal wall is tight and we're, it's not the easiest thing. So the lubrication, and then as far as it will go, you still get the benefit of the light because of the way the wand is designed. The tip has 3 diodes that are red. And those are the diodes that do the job of reducing inflammation, helping the cells return to normal. And I say it's well worth patience. Does that help?
Yeah, that's great. Okay, and so these are other things about using the wand. Of course, it's intended for adults, over 18. It's not waterproof. Don't submerge it in water, but you can, of course, clean it, and only use the USB adapter that came with it. And like I said earlier, don't ever use it while you still have it plugged in. These are all just things you probably don't need me to read, but I will anyway. Don't try to modify or disassemble it. And, if the safety seal is broken on the outer box, don't use it. It is designed for individual use. Always clean it after each use. And it's intended for vaginal insertion only. Now, having said that, I know Bree has gotten a lot of comments about this, and so have we, that men are like, hey, we need some help too, And so I know there are plans in the future, and we've had people use it externally, like on a sore wrist or a sore ankle or whatever, because the light is coming out, of course. So, and then only water-based lubricants should be used. Of course, with any light therapy, we're not going to stare directly into the wand. And pregnancy, the contraindication listed for pregnancy is really more of a caution, but considered a contraindication because nobody wants to find out that anything is not good for a pregnant woman. Okay, so it's not that we know of anybody that had an issue when they're pregnant using any kind of light therapy or photobiomodulation. It's just no one wants to find that out. That's just standard for everything in the holistic field. We always have to say that. If you're sexually, if you have an active sexually transmitted infection, you got to really be careful with it because it could aggravate, the condition. And if you have a photosensitivity, then any kind of photosensitivity where, you're not supposed to be using light, well, then you don't want to, do that. So I have another question here. Let's see. Can you recommend a non-toxic lubrication? So many lubricants have toxic chemicals in them. Bree, I want you to take that question.
Yep. So within about 3 weeks, MyElle will be proudly partnering and selling lubricant by Good Clean Love. And they use a technology called osmolar technology, which works with the body's natural biomes. It's the safest lubricant by far on the market. It's one of top 3 lubricants in the world. If it matches the vaginal or the body fluid almost perfectly. So we will be selling that within the next few weeks, and Ginger will have that as well. So just look out for that. And we'll be putting samples into every wand that someone buys. And if you already have a wand and you haven't gotten a sample, then we will be shipping out a sample to everyone who's purchased a wand so far from us as well.
Okay, so I bet a bunch of you who don't have wands already, you're ready for your wand. And our request is to go back to the person who told you about this webinar, or introduced you to MyElle, and make your purchase through them. We're all working together, and we're educators, so we're going to stay out there educating the field. And a lot of the light therapists are sending us people to listen to these presentations, so go back and transact with them. At this time, also, I will really want to thank Diana Conley and Del Mason and Photonic Therapy Institute for creating this presentation to start with. And I want to thank you for attending. But now, and so thank you, thank you, thank you. If there are any questions, we still have Bree and Marcy on the line. Let's have some questions. But if not, we're just going to say thank you, and we're going to stop the recording. But if some of you think of a question you want to ask after the recording stop, we'll stay on for a few minutes. So thank you again, everybody.